viewers. I welcome you all in my surgery online class. Last time we have taken an idea of a lymphoma, that what is lymphoma. Lymphoma is a cancer of the lymphatic system which is part of body's germ fighting network. The lymphatic system includes the lymph nodes, lymph glands, spleen, thymus gland and bone marrow. Lymphoma can affect all those areas as well as other organs throughout the body. So lymphocytes are a type of white blood cells. And lymphoma is the cancer of this lymphocytes, the germ fighting cells in our body. Lymphoma is subcategorized into two types, Hodgkin's lymphoma and non-Hodgkin's lymphoma. The Hodgkin's lymphoma is the most common type of lymphoma. Till the reports gathered, Hodgkin's lymphoma is more common among the males in compared to the females, and it has got bimodal presentation. Lymphoma is seen in young and adolescents between the age of 20 to 30 years as well as in elderly persons above the 50 years age. The persons with a weak immune system is more at risk. So the patients with HIV are at higher risk. The causes or the main reason behind the Hodgkin's lymphoma are the viral infections, especially infectious mononucleosis, Epstein-Barr virus, HIV infection and genetic monoclonal B-cell disorder is reported among 90% cases. Other etiological factors include weak immunity, certain drugs used after an organ transplant, age particularly above 50 years, or if a patient is having a family history of lymphomas. Grossly, lymph nodes are fleshy pinkish gray and rubbery in consistency. Hodgkin's lymphoma is a lymphoid neoplasm composed of Reed-Sternberg cells in a background of reactive inflammatory cells. So microscopically, it contains a cellular infiltration with lymphocytes, reticulum cells, histiocytes, fibrous tissue and Reed-Sternberg cells. This is the classic presentation. These Reed-Sternberg cells are a giant cell having two nuclei which appears as mirror images. Each nucleus contains a prominent eosinophilic nucleolus surrounded by a clear zone. Cytoplasm is eosinophilic and amphiphilic. You can see in the picture and easily remember for the exam, these Reed-Sternberg cells have a characteristic bilobe nucleus with large nuclei giving the classical owl eye appearance. So these Reed-Sternberg cells are the hallmark of disease. Cells with mirror image nuclei and prominent eosinophilic inclusion like nuclei, Reed-Sternberg cells. These are large multilobulated nuclei, colonal in origin. Now signs and symptoms in case of Hodgkin's lymphoma. Firstly, there will be involvement of the nodes of the neck and shoulder region and of the chest area. There will be presence of swollen lymph nodes and lymph nodes of axillary, mediastinal and inguinal and abdominal lymph nodes may also get involved. Other features are fever, night sweats, fatigue, itchy skin, weight loss, anemia. There is bone pain and anemia. This all are B stage symptoms. Stage A is absence of the symptoms, which signifies better prognosis. There could be enlargement of spleen, that is splenomegaly. There could be enlargement of liver, that is hepatomegaly, reported in 5% of the cases. Enlarged, painless, rubbery, non-erythematous, non-tender lymph nodes are the hallmark of the disease. And these lymph nodes may become painful after drinking alcohol. Patients may develop B symptoms, that is drenching night sweats, weight loss, fever, anemia and pruritus. Although pruritus is common in the disease, but it is not one of the B symptom. Cervical, supraclavicular and axillary lymphadenopathy is the most common initial sign of the disease. Lymphadenopathy involving the lymph nodes of cervical and supraclavicular region. Lymph nodes are painless, non-tender, firm and rubbery. Hepatomegaly and splenomegaly may occur. Cough, dyspnea, hypoxia, pleural or pericardial effusion, hepatocellular dysfunction, and anemia, neutropenia, and thrombocytopenia may also be reported. There is repeated infections and superior vena cava obstruction that lead to facial edema. Now, classification of Hodgkin's lymphoma. It is classified into nodular lymphocytic predominant Hodgkin's lymphoma and classical Hodgkin's lymphoma, that is subcategorized into other categories. Now, investigations for the Hodgkin's lymphoma. PET scan are also useful in functional imaging and used in assessment of disease spread and staging. Besides this, other imaging techniques are used like chest X-ray to look for mediastinal lymph nodes, pleural effusion, ultrasonography of abdomen to look for involvement of liver, spleen and abdominal lymph nodes. CT scan of the mediastinum, chest, abdomen and pelvis is done. Lower limb lymphadenography to look for the pelvis and retroperitoneal lymph nodes. Then FNSE of the lymph nodes is done and blood test is done to look for ESR, peripheral smear, blood urea, serum creatinine and serum alkaline phosphatase calcium may get elevated during the blood test. Treatment of Hodgkin's lymphoma include chemotherapy, radiation treatment, ABVD, BCOPS and escalated BCOPS. ABVD is becoming more popular including the drugs andriamycin, bleomycin, vinblastine and dacarbazine.